Good morning, all of you. I am Tharanga Amarathunga, a student of IHS. First of all, thank you very much for joining today my session. Actually, I am going to discuss about hypertension. I will share my screen. These are the learning outcomes. By the end of this lesson, you will be able to define hypertension, mention risk factors, describe causes of hypertension, explain signs and symptoms of hypertension, distribute, dis, describe diagnostic evaluation of hypertension, explain the health education for patients with hypertension. Okay, so as I mentioned earlier, I am going to talk about hypertension. Firstly, I have divided my presentation into three sections for my convenience. First one is define hypertension and risk factors. Second one, causes of hypertension and signs and symptoms of hypertension. Third one, diagnostic evaluation of hypertension and explanation of the health education for patient with hypertension. Okay, so let me now move on to the next slide, which is definition of hypertension. Systolic blood pressure equal or more than 140 mercury millimeter and or diastolic blood pressure equal or more than 90 mercury millimeter on the average of 2 or more readings taken at each of 2 or more visits after initial screening according to the WHO guideline. Next, move to the next slide. What are the benefits of lowering BP? Antihypertensive therapy has been associated with reduction stroke incidence 35 to 40%, myocardial infarction 20 to 25%, heart failure more than 50%. Then move to the next slide. Risk factors. Risk factors are divided to two categories. One is modifiable risk factor and other one is non-modifiable risk factor. Modifiable risk factors are unhealthy diet, physical inactivity, tobacco and alcohol use, and overweight or obese. Non-modifiable risk factors are family history, age, coexisting disease, diabetic, kidney disease, like that. Okay, let me move to the next slide. Causes of hypertension. Smoking, being overweight or obese, lack of physical activity, too much salt in the diet, too much alcohol consumption, more than 1 to 2 drinks per day, stress, old age, and genetics, family history of high blood pressure, chronic kidney disease, adrenal and thyroid disorder, sleep apnea. Now move to the next slide. Common symptoms of hypertension. Common symptoms of hypertension are early morning headaches, nosebleeds, irregular heart rhythm, vision changes, buzzing in the ear. Causes of severe hypertension: fatigue, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors. Let me move to the next slide. How to diagnose hypertension? Firstly, monitor BP regularly. Next, we can do ambulatory BP. Then, routine laboratory test recommended before initiating therapy for all patients. Urine analysis, hematocrit, chemical profile, blood sugar, urea, creatinine, potassium, calcium, uric acid, lipid profile. Then 12 leads ECG and echocardiogram. Okay, so let me now move on to the next slide, which is lifestyle modification. If we follow a healthy lifestyle, we can prevent high blood pressure. Lifestyle modification are weight reduction in those individuals who are overweight or obese, adoption of the dietary approaches to stop hypertension, eating plan, which is DASH diet, practicing moderate intensely physical activity, then avoid smoking and reduction of alcohol intake. Adapting to a healthy lifestyle and thereby reducing drug treatment and reducing drug dose. As mentioned earlier, it can also the risk of heart disease for someone with high blood pressure. Then next move to the other side. Health education messages on hypertension. Hypertension necessitates lifelong treatment. It can be managed but not cured because hypertension is frequently asymptomatic and can progressive silently. It is called silent killer. It is critical to monitor and manage blood pressure on a regularly. Hypertension is a major risk factor for many cardiovascular disease, including heart attack and stroke, which can be avoided with proper control. Lifestyle changes are an important part of the because they improve hypertension control and reduction. The number and doses of medication required. Because hypertension is usually asymptomatic, treatment is based solely on blood pressure readings rather than symptoms such as headache, dizziness. Diagnosis of smoking not only is terms of hypertension, but also cardiac and lung health. Then stress can contribute to hypertension, but it is not the most common cause. The most common factor is a genetic predisposition. While both systolic and diastolic BP are important, SBP may be more predictive of complications than BP, specialized in the elderly. Acidic foods and plants such as garlic are ineffective in lowering BP. Then let me give you a summary of what I have been talking about over the last few minutes. Firstly, we talk about what is hypertension. After that, what are the risk factors for hypertension? Next, I describe causes of hypertension. Then I discussed common symptoms of hypertension. Furthermore, we talk about what are the diagnostic evaluation of hypertension. Lastly, we discussed health education for hypertension patients. These are the references. Let me move to the last and important event. That is question and answer session. Do you have any question regarding this topic? Please ask me. Yes, good question. Thank you for bringing. What exercises should do a patient with hypertension? For those who have hypertension regularly, physical activity can bring blood pressure down to safer level. Some examples for aerobic exercises: walking, jogging, cycling, swimming, and dancing. Yes, what is the body weight a hypertensive patient should maintain? Yes, to stay healthy, we all need to keep our BMI below 25 kilogram per square meter. Yes, very good. What is the DASH diet? Yes, while we all eat a well-balanced diet, other than that, DASH diet recommended for hypertensive patient. What is DASH diet? Eat more fruits, avoid foods and high in saturated fat, cholesterol and trans fats. Eat more whole grains, fish, poultry and nuts. Limit sodium and sugary drinks, red meats, like that. So I think you have got a good understanding about hypertension, right? Thank you. Well, I think I want to thank you once again for allowing me to speak to you today. If you have any further question or want additional information, please contact me. Thank you very much.